Good morning, everyone. Welcome to Statewide Disability Advisory Council, or SDAC. Today is a very special day. We are having a virtual event in honor of 30th anniversary of ADA, Americans with Disabilities Act, and also 75th anniversary of NDEAM. My name is Bobby Dutta. Eduardo Juarez and I are the co-chairs. Now, to kick off our event, we have Secretary Mark Ghaly. Secretary Ghaly is a Harvard-trained physician and a prominent public health expert. He was appointed in 2019 by Governor Gavin Newsom as Secretary of California Health and Human Services Agency, overseeing California's largest agency committed expanding health coverage and access and providing safety net services for our most vulnerable neighbors. It is a great honor to present Secretary Ghaly. Welcome, Secretary Ghaly. The floor is yours.
Beautiful. Thank you, Bobby, and thank you all for allowing me the honor to kick off this event. I'm sorry my Wi-Fi access where I am at the moment isn't so great, so I'm going to go free of video to make sure that I don't have a bad connection. But it's great to see many of your faces and to be part of this terrific event. We've been busy over the last year. It has been not just the initial beginning of the year where we were really looking forward to a new budget opportunity and lots of additional funding to really advance a California for all on so many things, health and human services. And, in the wake of a fairly intense year last year with PSPS events and a number of challenges for all of us to figure out how we create a more equitable California in the face of disproportionate impacts of fires and then those outages and the lessons we learned about increasing and improving access for all Californians. And then in January, we started really our response to COVID, and California was the first state to take this, I think, on full steam, given our role in helping welcome Californians and Americans back from overseas who might have been exposed, and then the many repatriation efforts of cruise ships from various parts of the world with our neighbors and Californians and Americans on at large. So we did early on get some experience and made some decisions early that I think were incredible and protected the state. That said, I often say COVID is the great unmasker and the great accelerant. And what I mean by that is it really unmasks so many of our communities, our states, disparities. We've seen the impact on older Californians. We've seen the impact on people who depend on so many others to feel connected, to be connected in community. And the fact that we've had a number of orders put out by the governor under the advisement of our public health team that really are meant to protect Californians, but do have consequences that keep us a little bit more removed, more isolated. The number of individuals who are experiencing anxiety and stress and full mental health and substance use disorders anew, and some that were under good control are now less controlled. So many consequences of these important public health decisions, and it has been an important balance that I've had the privilege to help support California in leading that, and working with a number of local partners on ensuring that even though it unmasks many disparities, many of the obvious ways that COVID disproportionately impacts communities of color, individuals with underlying health conditions, those with functional needs. Many, many different communities across the state. But I also say that COVID is the great accelerant. And what I mean by that is that COVID has given us an opportunity to make years of change in just weeks to months. And I can give you many different examples of how that tremendous California will, California know-how, California ingenuity and creativity have come together to really move our state forward in ways that I don't think we'll ever look back. And one of those is how we work. And you'll see, I think it's pretty incredible overnight. I don't know if we even did a show of hands, how many of you done a Zoom call in 2019? How many of you been part of these ways of interacting and communicating? And most of us haven't. And today, I think you'll have more Zoom calls, even if you were familiar, you'll have more Zoom interactions today and this week than you did in probably your lifetime before COVID. And what that has done is created this very incredible opportunity for us to work differently, to define teams differently, to define how we use our skill sets differently. It's I think, a really tremendous opportunity that I know Health and Human Services Agency is leading the way, both for our internal departments on how individuals can work differently. Remote working is the norm. We've begun to survey in different parts of our agency how many people want to come back. And yes, there's some, and many people want a mixed option. They want to come back for part of the week, but then spend the other part of the week working from home. I've heard everything from I'm more efficient. I don't have to take a shower first thing in the morning. I don't have to spend 30 minutes on my whatever it is that helps you get ready and feel ready for a more public display. So all of those things are tremendous pressures and time that we win back. And I think for others who maybe found just getting to work more challenging, that there were certain opportunities now for us to really enhance the sort of set of tools to allow people to work at home. And I think that is really the next big thing for us within the state, working with our GovOps, government operations partners, on really standardizing that. And I hope giving us the option to, do so many important things for our climate, reduce our carbon footprint, improve how our employees and our staff feel about work, and I think really enhance our ability to team and work together. I have always have loved the concept of the teamlet, small teams working as part of bigger teams that come together. And so many of our new Zoom-like Microsoft Teams, these different platforms give us a chance to work differently. So I'll wrap up now by just saying, COVID has been a challenge like nothing else, once in a lifetime, really tremendous effort and, global pandemic that we all need to work to keep California safe. But I will say that my hope is that in 5 years, when we look back at this period, yes, we'll be sad for lives lost and jobs lost and businesses lost and educational loss for young people and older adults as well. But we'll also look back and say, well, we're grateful for the advances we made because of COVID, that there are things that we've done that we would never have been able to do. And even the thought of them would have sounded a little bit crazy in 2019, and today they are exactly what we're talking about and how we're moving forward. So I look forward to hearing from this group and many others on how we can do that better. But I really wanted to highlight that as you get through your thinking and your aspirations on how we take what has been a global challenge and disaster on many rights, but to transition that into something that can help us really make some improvements in not just the way we work, but the way we live all together. So with that, Bobby, I'll turn it back to you, and just really grateful for the work all of you are going to do in this conversation, in this conference. And I know I'm glad I got to go first because some of the other speakers have tremendous track records and I know are going to be fantastic additions to this whole lineup. So Bobby, thanks again.
Thank you, Secretary Ghaly. We are so grateful that you took the time out of your busy schedule to address our group. So thank you again for an informative presentation and help kick off our NDEAM event. You have yourself a great day, sir.